Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the country further eases restrictions in the NCR Plus amid the high number of COVID-19 cases and a grim warning that the country could face an India-like surge if we let our guards down. There's no stopping two lawmakers from distributing the unregistered drug ivermectin despite opposition from medical groups. And OCTA Research reports a decline in daily COVID-19 cases in Metro Manila, but the group points out it's still too early to decide if the region's status can be downgraded to general community quarantine. Infectious diseases expert Dr. Rontgene Solante and OCTA Research fellow Ranjit Rye join us live in the program. More businesses have been allowed to reopen in areas under modified enhanced community quarantine. Restaurants can now hold indoor dining operations, but only at 10% seating capacity, while personal care services like beauty salons and barber shops can now reopen at 30% capacity. Despite the more relaxed protocols, government is warning that we could face a crisis similar to India's if people don't follow the minimum health standards. On Saturday, India recorded more than 400,000 new infections for the first time. Let's go straight to the source of the story. We have infectious diseases expert Dr. Ranjit Solante. Dr. Solante, welcome back to the source and maraming salamat po sa inyong oras.
Good morning, Pinky Webb.
So let's look at the cases. Yesterday, we recorded 8,300 cases Sunday, while OCTA has actually said that the cases have gone down about 11% from an average of about 9,200. We're seeing an average of 8,200 the past week. But I guess what I want to find out from you is that why do you think we're not seeing a significant drop in cases, considering we've been on ECQ and MECQ for more than a month?
Yeah, agree. It's not yet the significant drop of the cases, but it's really just so enormous number of cases, I think. And it will really take time that the cases will go down, no? And but it's a welcome information that at this point in time, there is now a downtrend in terms of the number of cases per day. And somehow we felt that in some of our hospitals, but still most of those admitted are the severe and critical.
Okay, so are you saying then because the numbers were too high, that's why it's taking a while for the numbers to actually start going down? Kasi I remember, Dr. Solante, umabot po tayo ng 12,000. So if we're looking at, more or less 5 weeks of ECQ and MECQ, parang bumababa siya, in my count, parang an average of 1,000 cases every week.
Yeah, because when you look at the exponential growth of these cases starting in March up to April, it's really a significant increase in the number. And in fact, the reproductive number also reproduction number was also very high. So it's also natural, looking at the course of the infection, when you have 2 weeks of clinical manifestations and you have 7 weeks of highly infectious state, then it would also take that long that the observation for the downtrending will really be slow.
So while it's taking a while, Dr. Solante, what do you think, or was it wise? Do you think that government decided to slightly open some sectors, such as 10% indoor dining and 30% personal care services? What about the timing of that, considering na pakonti-konti pa lang yung pagbaba ng mga kaso?
Yeah, I think the gradual opening of this establishment, we can look at it as something of a development also, and we have to monitor closely if this gradual opening will affect the cases in the next 7 days or 14 days from the time that we will implement it. Now, because the 10% or the 20% increase in the number of people, there should also be implementation with the strict implementation of the health protocol, including ventilation in those areas, because these are high-risk areas in closed spaces.
I know we've talked about that over and over again. So your benchmark would be 2 weeks after these industries open. We have to see the numbers. In other words, you're saying that kapag nag-plateau tayo, let's say, Dr. Solante, at 8,200 or even tumaas pa tayo ng konti, that means may problema yung pagbukas ng mga bagong industriya.
Yeah, as long as after a week or two from now na hindi siya tataas, kung nagpa-plateau lang, then we can accept that particular plateau, no? As long as hindi lang tumataas. Pag tumataas na naman yan, then there's something wrong really with the cases being driven by opening of these establishments.
Tell us the situation now in San Lazaro, the ICU and the ER situation there.
Well, our ER as of this moment, no, wala na tayong pila. And in fact, our number of cases, daily number of cases has dropped also, but not a significant drop.
What's the drop, sir?
Like 15 to 20% from the previous of the benchmark, which was around 150 cases.
So, wala na pong pila, ha? Sa ER?
Wala na. So
Okay.
we can accommodate kung merong those who want to be admitted, no, we can accommodate them.
So I guess also I wanted to ask you, why do you think it seems so difficult right now to bring the cases down? I mean, at some point, I want to find out from you, sometime in January or the whole month of January, the cases we were seeing were about 2,000 at an average. When do you think babalik po tayo doon sa numero na yon? I only ask that, Dr. Solante, because that was the time that all hospitals could accommodate kahit po yung mga mild and moderate cases.
Yeah, this is the situation why this pandemic is really very unpredictable. And we know that the drivers of increased cases is the unrestricted social interaction, not following the health protocol. And there's always a possibility that if we relax our implementation of this protocol, we will really see, again, a surge of cases. So that's how delicate the risk of transmission at this point in time. It's not stable yet.
Yeah, it seems it's very sensitive. We have to look out for every single red flag that may appear, which brings me to my next topic. What's happening in India right now? We see what's happening over there. Secretary Duque was saying that, if we don't follow minimum health protocols and if government does not intensify its COVID-19 response, there's a big possibility, he says, that a similar surge, such as what happened in India, can actually happen to us. As somebody who's an infectious disease doctor, what are the possible red flags for you? Number one. And number two, nangangamba ho ba kayo na yung nakikita niyo po o nakikita natin na India surge could actually happen here in the country as well?
Yes, Pinky. No. Number one, what causes the surge of India? It's really the unrestricted social interaction. They have a lot of these mga religious gatherings, including mga political gatherings. Number two, there was also the possibility of a variant-driven surge because of the Indian variant. And then number three is because of the low vaccination rate. So all of these can be seen in any country, especially the Philippines, if we will not take note of how to really implement all of these measures to decrease the transmission, both in the community, the workplace, including areas where you have high risk of transmissions.
But that's the point. What else do you think needs to be done para hindi po tayo umabot doon? What among the existing protocols, number one, should we add or should we improve on?
I think what very important now is to really do active contact tracing and quarantine, no? Because that's where most of the cases that before they are hospitalized, that is where most of the transmission are happening. Second, we need to implement fully the health protocol, especially ventilation of enclosed spaces, especially if we are going to open the malls or the other establishment. And then we need to monitor all the cases. So still contact tracing, testing, and implementation of the health protocol including engineering controls of enclosed spaces.
And I guess very important there is that we don't let our guards down, especially if the cases start to go down. Dapat intensified pa rin yung kahit na bumaba na po yung contact tracing, yung testing, at yung quarantine.
Yeah, correct. No, because this is our life now. No, we need to accept and behave like this is how we should behave, and this is how we also have to be disciplined in following all the health protocols in terms of implementation of health protocols in enclosed spaces, even in public places.
All right, let's talk about ivermectin. Dr. Solante, so first, tell us your thoughts on the distribution of ivermectin.
Well, so we were alarmed with that, no, because after that we received a lot of this reaction coming from not only from physicians but also patients that there are those who develop adverse reactions. No, so the Philippine College of Physicians has released our statement yesterday, and we'll be having a media conference this morning also. There's still insufficient evidence that the ivermectin has a role in the prophylaxis or in the treatment of COVID-19. And what we are alarmed of is that prescription has been flying all around and being used by most patients without the proper guidance and monitoring of possible adverse event. And it's really occurring in some of these patients.
Okay, so when you talk about that prescription, when the 4 doctors in Quezon City distributed ivermectin, there are questions on social media about that. Yung iba walang pangalan. It was just a signature that, well, you couldn't really read, which could be normal, di ba? Kasi hindi naman minsan talaga na iintindihan yung signature, pero walang pangalan daw ng doktor. And then the PR license number, somewhere there, I think they were a 6-digit number. Did you see anything wrong with those prescriptions that were handed out?
Dapat kompleto yun, no? And at the same time, siguro, isa sa mga nakita natin dyan, na pag binibigay na yung mga prescription na yan, they should also explain the possible adverse reaction. And what if this reaction are present in this patient? Meron ba silang contingency plan that these patients will go to what hospital or what clinic so that they can be monitored also? Or are they being monitored daily or once a week or twice a week as long as they are taking the medications? Yun yun kami nabahala, no, sa monitoring sa mga adverse reaction.
Okay. There is, of course, anecdotes on ivermectin, people saying it's worked for them. And of course, you have medical professionals saying there's not enough data. The WHO saying there's not enough data to say that ivermectin is number one, a prophylaxis or works against COVID-19. But we'll talk about that after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, infectious diseases expert, Dr. Ranjit Solante. Dr. Solante, balikan ko po yung prescription. So, yun po, sabi mo, kailan complete? Hindi ba kailan may date, yung name ng pasyente, yung dosage, yung pangalan ng doktor, yung signature ng doktor, tsaka yung license number niya. Did I miss anything?
Yes, that should be a complete document, no? Yung kung nagbigay tayo ng mga gamot, especially when you have this is still an under compassionate special permit, no? Hindi pa to talagang commercial na you just have to give this to anyone, no? Kasama sa CSP is really the monitoring of these patients, especially the adverse reaction, no? Kaya nga ang pag-issue ng CSP is doctor driven. Kung sino yung gagamit ng gamot na to, so siya yung bibigyan ng compassionate permit na authority para lang ibigay doon sa pasyente na yun. And he should also be liable kung ano yung mga adverse reaction kasi magre-report din siya ng mga adverse reaction based doon sa mga binibigay niyang gamot na CSP.
So what happens, because they were made to sign a waiver, those who accepted or received ivermectin, pero meron pong waiver. So now the question really is, are the doctors going to be liable or does the waiver stand?
The waiver will only give you the permission that the patient knew that there are possible adverse events This is also the possible benefit, no? And despite this event or adverse reaction, they will take the medication because that has been explained, no? Pero iba ang waiver, iba din yun kung mag-develop ka ng mga adverse reaction. Kasi saan ba yan pupuntang mga pasyente na yan pag mag-develop ng adverse reaction? Di sa hospital pa rin, no? So, sinong mananagot niyan? Kung ma-hospitalize under ba yan sa PhilHealth, sasagutin ba ng ano or it's out of pocket?
But would the 4 doctors who were in Quezon City be liable?
I think it's for the Department of Health or FDA to look at it because under the jurisdiction of the CSP, there are provisions there na dapat titingnan din nila.
So I want to go back to what I said before we went on break. There are anecdotes. Ano po, Dr. Solante sasabing gumaling sila. Sinasabi naman ng mga medical groups, there's not enough data. WHO saying there's not enough data. I spoke to Congressman Defensor last week. Ang sabi nga niya ito, kung hindi epektibo, edi napurga ka. Kung epektibo, nasagip mo ang buhay. What do you say to that?
Well, that should not be as simple as that, no? Because for one, when you are giving a medication that has lack or insufficient evidence that this is the treatment for this, so para ka rin lang nag-eksperimento, then why not do a clinical trial and make a trial-like monitoring and enrollment of these patients, rather than just giving it left and right.
Another point he raised, I remember, he said that why the focus on ivermectin pero meron namang ibang mga gamot na pinapayagan din namang gamitin in a hospital setting such as remdesivir and these other medicine that is used for COVID-19?
Because these are drugs and medications that has already been proven, and there are already data coming from different foreign clinical societies, and including some of these big clinical societies, that it has benefit, no, in the management of severe to critical. Number two, these medications can also be monitored in the hospital. When you're giving this remdesivir or tocilizumab, it's easy for us to monitor the patient, and we also report adverse reactions secondary to these drugs.
I see. Kasi ginagamit nga naman siya talaga sa loob ng hospital under the guidance of the doctors. Just one very quick issue I wanted to discuss with you. Sputnik V, 15,000 doses arrived, and these will be distributed to 5 cities who have cold storage facilities. Ano po? But there's a question or a concern in Brazil about its efficacy and safety. Is this something you think government should look into first before we begin inoculating with Sputnik V?
For now, I don't see any issue with regards to the efficacy and safety of this vaccine. When we did evaluate this based on the phase 1, phase 2, and the published phase 3 trial, it passed our evaluation in the VEP and including that of the FDA. So that's the reason why we do approve, and FDA approve also for the use of this vaccine for our COVID-19 vaccination program.
So no need to pause first, like we did with AstraZeneca?
No need. No? So it's a go for this vaccine.
All right. Thank you, Dr. Rontgene Solante. Take care of yourself.
Thank you, Pinky, and to stay safe also.
Thank you. And coming up, the OCTA Research Group says Metro Manila is seeing an improvement in its COVID-19 response after reverting to a strict lockdown last month. We speak to OCTA Research Fellow Ranjit Rye when we return. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, OCTA Research Fellow, Professor Ranjit Rye. Professor Rye, welcome to The Source. Let me start with this. As I asked Dr. Solante a while ago, OCTA already said bumaba na po tayo on an average of 8,200 the past week from about 9,200 before that. Let me ask you the same question I asked him. Why is it still so high?
Well, good morning, Pinky, and good morning to our televiewers. Yes, indeed, the reproduction number has gone down from a high of 2 to 0.83. It's below 1. From 11,000 cases to a little over 8,000 cases. And in Metro Manila, it's moved down from 5,000, a peak of 5,500 cases to today to 3,144. It's taking time because it's a huge number, a base number that was very high when we started, 11,000 just a month ago for the whole country, and over 5,000 for the NCR. So it will take time for us to heal. The incubation period for COVID-19 is around 2 weeks, and it's taking on the average between 14 to 21 days, for people to heal. So it's taking time, and people have to understand that we still have a long way to go, to get back to the numbers before that we had before we had the surge.
Which actually is my next question. When do you think po babalik tayo doon sa 2,000 cases that we saw back in January?
Yeah, maybe towards, as we already discussed in our previous reports, maybe towards June. If we work on testing, tracing, isolation, expanding treatment, if we strengthen, not just maximize resources, but also improve coordination, collaboration between the private sector, civil society, and local and national government, we should be down by the first week of June to below, to nearing the levels we had, or a little over 1,000 cases by then. So our estimate, if we keep this particular reproduction number, we project that from May 2 to 8, we will have something like 2,800 cases. So by end of May, Pinky, we might most likely have less than 2,000, nearing the numbers we had before we had this terrible surge.
Yeah, I hope that projection really happens, Professor. So, but would the opening of some industries such as the beauty salons, beauty services of 30% and indoor dining of 10%, do you think that was a good idea? Was it a bad idea? Will this increase the numbers? Was the timing right?
I don't know about the bad idea, good idea. I feel that there was a balance that was need to be realized between lives and livelihoods, and the opening of certain businesses was a step forward as far as that that balance was concerned. Our position is that people who go to indoor spaces and will need to take their masks off are taking a risk at this point. We still have more than 3,000 cases. While the trend is going down, it's excellent. Okay, for us, it is quite reversible. Okay, the trends could change very quickly if people become complacent and overconfident against this virus. And it's a risk. It's really a risk to go out right now and take your mask off, and that's a challenge. So our suggestion is to take extreme precaution when situations like this, when we are in situations like this. Okay. That being said, I wouldn't like to comment on industries that need to be closed after being open. It's a decision of government, and we will support. And that's why we want people to be mindful that when you take off your mask in a public space that's enclosed, there is a risk, and it's a real thing. Apart from that, is that when you open up the economy, as we are doing now, over the last three weeks, it didn't just happen 2 weeks ago. It happened over the last 3 weeks, 4 weeks. A significant portion of the economy remained open, and parts are now being open. That we expect numbers to go up a little bit, but not in the way we had experienced over the last month and a half, where we had a surge of cases averaging around 5,000 cases a day, filling up our hospitals. So we're still optimistic. If we work together, we follow the minimum public health standards, we can sustain this downward trend.
I think it's very important what you said, Professor Rye, that especially if you are in an enclosed area, wear your masks all the time. Yun po yung sinasabi niyong napaka-importante. So, but I also read a report coming from OCTA that there are areas of concern. If I'm not mistaken, they are Zamboanga and Bacolod. Would those be the correct areas?
Yes, these are areas that I think the government is also seeing as areas of concern. And here we have to be proactive and find a way to ramp up testing, tracing, and isolation, and prepare the LGUs concerned with regards to hospital capacity. It's a little worrisome for us because the increases are significant. But definitely the focus is still Metro Manila. Our projections from OCTA tell us if we work hard to work together, we should be getting something like 2,800 cases from May 9 to 15 with this R. Okay, so it is going down. I would like to emphasize it is going down. It is going down slowly, and it will go down slowly from now on, because we've opened up a significant portion of the economy. But it is volatile. The R is at between 0.8 and 0.9, and we need to stabilize it. We need this week. We had to make this MECQ work for this week to knock it down to below 0.8, and we need to sustain that so we can have not just less cases, but also less pressurized, less overwhelmed hospitals. So the hospital capacity is already improving at 56%.
Yeah.
Okay, in the NCR, but the ICUs are still filled up. There are 804 ICU beds occupied. It's the highest in NCR since the start of the surge. So people are recovering, but it's taking time.
Professor Ranjit Rye, thank you so much for your time. Really, it's important to underscore that let's be more careful, even if there are a number of industries. Mas mag-ingat pa tayo. I guess really that's what's very important. Thank you. Thank you so much for your time, Professor.
Thank you so much, Pinky. Thank you.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.